Hi there, this is Ross from the Academy of Medical English, and in this video we're going to look at how your language is graded during the speaking subtest of the OET exam. Now there are two sets of criteria that you'll be judged on when you take the speaking subtest. Those are linguistic criteria and clinical communication. Now, of these two, the one that probably looks less familiar to you is clinical communication. That's something that we're going to look at in the next video, but essentially it's about how you manage the conversation with the patient or the other person, how you approach the conversation to make the other person feel comfortable, how you steer or guide the conversation to get the information that you need out of that interaction. And it's less about, for example, grammar, vocabulary, and pronunciation. Okay, for those things, we want to be looking at the linguistic criteria. And that's what we're going to focus on today. So again, the linguistic criteria deal less with your interpersonal skills and the way that you guide the conversation, and they're more focused on the traditional areas of assessment that you're probably used to being tested on in school or in other exams. So let's have a look at the four areas these criteria fall into. The first of them is intelligibility, and what this means simply is, can the assessor understand you? Okay, we've got here the three highest bands that you can achieve in this part of the exam, and let's look at what you need to do to reach each band. So for a level 4, you only need to be easily understood most of the time. Okay, so what that means is that there is some room for error. There can be some occasions where the listener has to strain a little bit to understand what you're saying. So long as this doesn't happen too often, then you can still achieve that band 4. However, to achieve a band 5, you need to be easily understood at all times. Okay, there can still be some errors in pronunciation, or what we call prosodic errors. So perhaps you use the wrong word stress, you stress the wrong syllable in a word, but the important thing is that the assessor can still understand clearly what you're saying. And then to get the top band, a band 6, not only do you need to be easily understood all the time, but you also need to show an ability to use features of pronunciation like your intonation or the word you stress in a sentence to enhance your communication, right? To allow you to communicate more precisely or more effectively. So this might be something like raising your intonation at the end of a sentence to show that it's a question, right? Or stressing a word in a sentence that wouldn't normally be stressed to put emphasis on that piece of information. So that's intelligibility. Essentially, can you be easily understood? Is your pronunciation clear? Next up is fluency. Now, what this again means essentially is, how often do you hesitate? Do you spend the whole task going trying to think of the word you need in English, or are you able to communicate your ideas without pausing too often? So here again, for a band 4, we can tolerate some repetition while you think about what to say next. Perhaps your speaking isn't completely even. Perhaps you sound a little bit robotic when you speak. Nonetheless, if you can still essentially get your thoughts out and communicate to the other person, then you can achieve a band 4. For band 5, it's really the same kind of factors that we're thinking about, repetition and hesitation. However, there needs to be simply less of it in order to achieve the band 5. Finally, to get that top band, band 6, the only hesitation that the assessor should hear should be coming from you searching for the content of what you're going to say, rather than because you can't think of the words you need to express it. Because of course, even when you're speaking in your mother tongue, you probably hesitate. You can hear me hesitating right now, thinking about exactly what I want to say. But the important thing is that that hesitation is not caused by a lack of vocabulary, okay, or a lack of knowing the correct grammar structure to use. So, next up we have appropriateness of language. What this means is your choice of words right for the situation? So something like a doctor's office is quite a particular situation, and the communication between a doctor and, for example, a patient is quite different from how a doctor might talk to their friends if they meet them in the street. It's more formal, but also it's going to be different from how the doctor would communicate with someone like their consultant, because the average person on the street probably doesn't have the same medical or academic vocabulary that you would use when talking to another medical professional. So it's not simply a matter of being formal enough for a professional interaction, you also need to know how to express sometimes quite difficult concepts in a way that the average speaker of English will understand. So to get that band 4, you can be somewhat restricted and lacking in complexity. In other words, you may phrase things in the same simple way because perhaps you don't know how to say it in a more formal way. You may sound a bit too informal because that's the only way you know how to say something. Or on the other side, you might know some complex Latin term, for example, but lack the English vocabulary to say it in an everyday form that the average person would understand. Okay, to get the level 5, it needs to be mostly appropriate. So again, just fewer uses of inappropriate register, and any errors that you do make should not get in the way of what it is you want to say. They should not make it too difficult for the other person to get the information that you're trying to express. Finally, to get the band 6, it needs to be entirely appropriate with no difficulty at all explaining technical matters in lay terms, in other words, in everyday language. So there's not much room for error, there's not much tolerance for mistakes to get that top band. The final area of criteria is resources of grammar and expression. Okay, so in other words, can you use a range of grammar structures and can you use them correctly in the correct circumstances? And this also applies to things like collocations, chunks of language, so not only grammar but vocabulary as well. If you look for band 4, then you can use some vocabulary inaccurately. You might try some more ambitious grammatical structures or ambitious vocabulary, and you might make a mistake when doing that. And these mistakes can sometimes cause it to be more difficult to understand you. However, crucially, the meaning of what you're saying should generally be clear. So although there is some tolerance for error, generally you still have to be very much understandable to get that band 4. To get a band 5, you need to show a wide range of grammar and vocabulary used accurately and flexibly. So, it's not simply enough to drop in some complex grammatical form you've learned, future perfect continuous passive or whatever. It needs to be used in the right context, naturally, and you need to get these structures right when you do use them. So there's not that tolerance for error when it comes to the formation of your grammar. And any errors that you do make should not be intrusive, so they should not get in the way of communication. Finally, again, to get that top band, you really need to show an almost native-like command of the vocabulary and grammar that you're using, and you need to be using complex language in a very natural sounding way. Okay, so those are the areas in which you're going to be graded for the linguistic criteria in your speaking task. Okay, so what we're going to do now is show you a real practice task with a real student of mine called Kasia, and I would like you to bear in mind all of the criteria that we just looked at and think, what band would you give her in each area for her performance? Now, we're only looking at linguistic criteria today. Okay, clinical communication we will look at in the next video, and I think we can safely assume that she will get at least a band 4 in each of these areas. Okay, so have a listen. What mark would you give her? And then at the end of the video we can see if the grades you have given are the same as what I think she should get for her performance. Okay, so without further ado, here we go. Hi, Doctor.
Hello, Mr. Smith. Please have a seat.
Thank you.
So, what brings you in here today?
Well, as you know, I recently had a heart attack.
Oh, I'm sorry to hear that.
Yes, it was came as quite a shock to me, and I was discharged from hospital 4 days ago, but since then I've been feeling very tired, and I'm just quite concerned about the prospect of what might happen if I start exercising again, for example. I'm very worried about the possibility of bringing on another heart attack. You know what I mean?
Yeah, okay. So, what is your biggest concern? What are you most worried about?
I suppose the thing I'm most worried about is that basically the doctors told me that if I have a second heart attack, it might be more severe than the first one, and I suppose other than the actual heart attack itself, what I'm worried about is whether or not I'll be able to get my life back to normal, or whether I'll be able to, for example, go back to work and just live my life in the way that I used to.
Oh, I see. Okay, I understand your concerns, and I know that it might be a little bit worrying to have a heart attack, and like the prospect of the further heart attack might be really worrying. So, beginning with your the first concerns you told me about, it's like being a little bit tired and not feeling like fully yourself for the first few weeks. That's completely normal. Your heart and your body as a whole, it needs some few weeks to recover completely. So don't worry about feeling a little bit tired. That's perfectly normal.
Okay, that's good to hear. And so, I mean, how much physical activity would you recommend? Because, I mean, I feel like I should be doing some kind of exercise, and I would really like to become more mobile, but I mean, I'm guessing obviously I shouldn't be running marathons straight away. So how much physical activity do you recommend?
Okay, so first of all, I would encourage you to join the cardiac rehabilitation program at our hospital. It's really brilliant, and I really think you will enjoy it. They will, apart from the rehabilitation, they will also provide you with some information that will help you to kind of kind of find out what is it all about, how much exercise you can do, and they will also improve your kind of stamina, and that will make you feel much better. Of course, as you pointed out, that was a very good point, that you are not supposed to run marathons straight away. But some mild exercise, walking, Nordic walking, just start from like 30 minutes a day each day, and then just kind of gradually increase the amount of exercise. I think that would be a good advice. Just, slow and steady, but just kind of go that direction, I think. It is very important for you to exercise, but also what is very important, to keep your diet, to lower your cholesterol. Also with like the kind of healthy diet and some exercises, you could possibly lose some weight, which is also kind of making your would make your chances of getting another heart attack much lower. And also the exercise is making your heart stronger, and it's making like more vessel connections, so in case of another heart attack, that might help a lot.
Okay, sure. And what about returning to work? I mean, in my job, it's an office job, basically. I work for a large company in their head office. So how soon do you think it would be advisable to go back to work?
Well, the work is not only like the physical work we're doing, it's also like quite a lot of stress, and it's also tiring when you go to work. Being like 8-10 hours at work like continuously, that might tire. Like even if you didn't have a heart attack, that might be a bit of a strenuous exercise. So what we usually recommend is between like 4 to 6 weeks after the event, before you go to work.
Mm-hmm.
You need to give yourself some time to rest and recover from the heart attack. Just make yourself, put yourself in the appropriate mindset, and also make your body feel much better.
Okay, sure. Well, thanks for that. And just my final kind of question is, you mentioned losing weight. Is there anything else particularly I can do to reduce the risk of a further heart attack in the future?
Mm-hmm. Of course, yes. So the things that you should do is like have a look into like the healthy diet. Probably the Mediterranean diet is like the most kind of cardiac friendly diet. The kind of some sort of exercises which we discussed before, like some walking, Nordic walking, just something not very strenuous. That would be a good thing. The other thing is that like as I mentioned with work, it's not only the physical work, but it's also the stress which is related to work. Maybe you can look into like some relaxation techniques, maybe some yoga. That would be a good exercise and like relaxation technique for you. I can give you some leaflets and you can look into that, and the next time we see each other, you will let me know what did you come up with. I can give you a call and follow it up. What do you think?
Yes, that sounds great. Thank you very much, Doctor.
Thank you.